Welcome to EnfinityCast, where we explore the moments in history that echo into our present. Today, we're looking back just over a century to a global crisis that, for a time, was overshadowed by the Great War, but whose impact arguably shaped our modern world even more profoundly: the 1918 influenza pandemic, often called the Spanish flu. To help us understand the scale of this event and its lasting legacy, I'm joined by my co-host, Lex Calder. Lex, welcome.
Thanks for having me, Elias. It's a heavy topic, but an incredibly important one. It's hard to overstate the sheer devastation of this pandemic.
Paint a picture for us. We hear the numbers, but what was the reality on the ground in 1918?
The reality was terrifying. We're talking about a virus that infected an estimated 500 million people. That was a third of the entire world's population at the time. The death toll is estimated to be anywhere from 50 to 100 million people. To put that in perspective, that's more than all the soldiers and civilians killed during World War I combined.
That's staggering, and it wasn't just the scale, but who it affected that was so shocking, right?
Exactly. Unlike typical flu strains that are most dangerous to the very young and the very old, the 1918 flu had a unique and terrifying signature. It disproportionately killed healthy adults between the ages of 20 and 40. It was caused by what we now call a cytokine storm, where the patient's own robust immune system would overreact to the virus, essentially attacking the body and filling the lungs with fluid. The very people who were supposed to be the strongest were the most vulnerable.
So in the face of this unprecedented biological threat, how did society and the medical establishment of the time respond?
It was chaotic and, frankly, inadequate. Public health as a discipline was still in its infancy. Cities implemented measures that feel very familiar to us now. They mandated masks, shut down schools, churches, and theaters, and imposed quarantines. But there was no coordinated national or international response. There were no antibiotics to treat secondary bacterial pneumonia, no antiviral medications, and no vaccine. All they had were non-pharmaceutical interventions and supportive care, which was quickly overwhelmed.
It sounds like the world was caught completely unprepared. So out of that failure and tragedy, what changed? What is the lasting legacy of the 1918 pandemic?
Its greatest legacy is the creation of modern public health. Before 1918, most medicine was reactive, focused on the individual patient. The pandemic forced a monumental shift towards a proactive, population-based approach. Many countries established centralized ministries of health for the first time. The concept of epidemiology, of systematically tracking disease, gathering data, and monitoring public health became a cornerstone of government.
So it professionalized the entire field of public health.
Precisely. It led to the establishment of public health laboratories, a greater emphasis on hygiene, and the professionalization of nursing. Socially, it embedded a new level of health consciousness in the public. It was a brutal, horrific lesson, but it forced humanity to build the public health infrastructure that, for the next century, would combat everything from polio to HIV.
A stark reminder that progress can often be born from catastrophe. It's a story of immense loss, but also one that highlights our capacity to learn and adapt. Lex, thank you for shedding light on this pivotal moment in medical history.
My pleasure, Elias. It's a history we should never forget.
That's all the time we have for today on EnfinityCast. Join us next time as we explore another echo from the past.